Hello and good morning, beautiful people. It is the day after Thanksgiving. It's been a while since I've shot a video for my YouTube channel. Obviously, since the end of July, I had a procedure done, in the beginning of August. Mid-August, I moved back up to Idaho where I'm attending school, and then it was like all gas and no brakes. A pretty rough semester, to say the least. However, there has been I guess you can say, events that have inspired me to shoot a video today, and I feel like it can be very helpful for a broad range of people. So within the last year, there have been a string of tragedies with bodybuilders passing away from cardiac events. And, somebody passing away from a cardiac event isn't necessarily uncommon. However, the striking detail, with these stories is the fact how young these bodybuilders were. These things shouldn't be happening. They do, but it's not ubiquitous. So we have to take a step back and actually see what's going on. And if we rewind to like 5 or 6 years ago, one of the more striking tragedies was with the passing of Dallas McCarver, who from a cardiac event at the age of 26 passed away. Now, these things can happen because there are genetic factors, and things within the heart that you may not be aware of that were just sort of like a ticking time bomb for you. However, it is more common than people think. It's just that most of the time we don't really notice it until somebody famous passes away. And it's not uncommon for bodybuilders to pass away from things like kidney failure or some type of, heart attack or heart-related issue. Now, I don't want to drag anybody through the mud, but I just feel this can be a teachable moment. Not just for bodybuilders, but for average people too. The things that you can do to protect yourself and to keep an eye on to make sure that you're in a good position. Now, I want to preface by saying that I do not, under any circumstances, condone the use of anabolic steroids. It's just one of those things that you probably shouldn't be doing. However, there are clinical instances where people will use anabolic steroids such as Anavar or testosterone, and this is usually to treat males with hypogonadism where their testosterone levels are so low. A doctor will prescribe therapeutic testosterone to boost their levels to an acceptable range to obviously increase this person's quality of life. However, there are adverse risk side effects that coincide with that, and these are the things that can potentially lead to a cardiac event. Now, if you go on social media where these tragedies are being posted, it's very polarizing because you have two camps. You have one side saying steroids killed them 100% completely, and then you have one side that says things happen, steroids had nothing to do with it. Now, what I want to do is coalesce those two camps to kind of create this bridge so we can see that yes, the steroids, contributed, but it was more indirect than direct. Like, it's not like poison. You inject poison into you and you pass away. The poison caused the death. These are one of those things that it creates changes in the body which, can be unfavorable, especially for, heart health, and eventually can lead to that. And then on the other side, you also have to say that, there are genetic predispositions and factors too that sometimes are not preventable, and this is why you really have to take your health seriously. Now, I'm going to talk about 3 things in particular today, and this applies to everybody, not just bodybuilders, not just anabolic users, but everybody. Things that you can do to protect your heart. Now, before brushing into this, I think it's important to educate people that, let's say if somebody comes to see me, like whether it's a clinical setting or cardiac rehab or just general health, we'll screen them and identify what the risk factors are, because if you have enough risk factors, we have to refer you to a doctor or a clinical setting where maybe we can hook you up to EKG monitors when we do this test, but you just need to be monitored quite closely. And these are the things that we take seriously. But keep in mind, these are risk factors. They're not like this equals death. It's just that this can be a problem potentially for you. Now, the number one is your age. Obviously, for males, 45 and above, females, 55 and above, your risk factor for a cardiovascular event goes up. Secondly, do you smoke? Now, it no longer becomes a risk factor if you quit and the quitting period exceeds 6 months. It's no longer a risk factor for you. your weight, obviously, and your body mass index is another risk factor. If you're overweight, this is obviously a burden on your body. Your blood pressure, which is going to be the first thing I talk about today, your blood lipids, which is your cholesterol, and also your blood glucose levels, so those are the things that are risk factors, and we add them up. You have enough risk factors, that there's obviously a change that needs to happen. We also have negative risk factors, and there's actually only one, and that's HDL. HDL is also cholesterol, but it's quite protective, especially of the heart and the vascular system. Now, in order for it to be classified as a negative risk factor, it has to be at 60 and above. And what that means is if you have a positive risk factor, let's say your age, and you have no other risk factors, the HDL will actually cancel that out, and you, in a sense, don't have any risk factors because that HDL is protecting you. So that's why I wanted to kind of just educate you. Those criterias are the things that you really want to keep an eye on. Now, what we're going to talk about first is blood pressure. Blood pressure really is the silent killer. It's something that I feel people just kind of don't take very seriously, but it's definitely something that can potentially cause issues down the road, not just for your heart health, but also for your kidney health. So what is the range that really you should be at? So it's 130 systolic millimeters of mercury over 80 dystolic millimeters of mercury. So I'm not going to go into what those numbers mean. Just know that that's the range that you want to be at. So at or below. But you don't want to be too low because then you're hypotensive, and then that's also an issue as well. Now, talking about bodybuilders, obviously, being a very large human being will undoubtedly increase your blood pressure, and non-bodybuilders, people who are just overweight, will undoubtedly increase your blood pressure because you just need more blood pressure to pump blood throughout a much larger system. So obviously the only way to really deal with this is to be lighter. So if you're overweight and not a bodybuilder, you can obviously lose weight, and that will help. Now, if you're a bodybuilder, there's not really much of a workaround, especially if you're competitive, especially if you really make a decent living on this. The only thing you really can do is monitor your diet and try not to get so heavy to the point where it is absolutely wreaking havoc on your blood pressure. But in the event that you can't monitor it and you can't control it, I highly recommend getting on some type of preventative measures in the form of medicine, which will help normalize your blood pressure. I know a lot of people are like, oh, I try to avoid medicine. And in most instances, through diet and lifestyle, yes, that is the way to go. However, if that is just not an option for you, blood pressure medication is extremely important because it will protect you. So why does blood pressure raise when you're a bodybuilder? Not just because of your weight, there's also other physiologic effects that happen in the body. Testosterone stimulates the production of red blood cells. Now, you have, let's say, for example, a certain volume of fluid, and that fluid, can carry so much, I guess you can say, particles in it. And as your red blood cell count increases, that, starts to get more and more saturated, and this actually leads to a thickening of the blood. You have now this thicker liquid matrix flowing through these vascular structures, and because it's thicker, you have what we call resistance, and it increases total vascular resistance. It's just not moving through the structures as smoothly as it wants. To compensate for this, blood pressure comes up to create more force to pump through those structures. So what's the workaround for this? Well, you would obviously monitor this with a blood panel. You would want to look at your hematocrit, and if your hematocrit is high, you know that your red blood cell count is getting, into a point where it's actually starting to thicken your blood. What you can do is you can donate blood. Donating blood will normalize your hematocrit. It will lower those levels, and it will ensure that your blood pressure isn't getting high because of that condition. But, if you're getting testosterone from a doctor, obviously they're going to recommend every 2 to 3 months that you go and donate blood therapeutically. So those are the workarounds. Blood pressure is not something that you want to take lightly. And lastly, just cleaning up your diet. Bodybuilders, especially, they're just notorious for having poor diets because we associate our health with how we look. And if you're very muscular and lean, you're not going to think your diet's a problem. What you don't realize is your diet actually is contributing to your blood pressure being chronically high because it's like a lot of salt and more things than you possibly need. So the workaround for this is to, obviously clean up your diet. But whether you're a bodybuilder or not, you should be monitoring your blood pressure. It is one of the easiest ways to ensure that you're taking care of your heart and your system. Secondly, blood lipids, HDL, LDL, cholesterol. Now, it's very frustrating in this day and age. You can go on the internet and you see a lot of these gurus talking about, especially ones who are like Atkins, low carb. Oh, cholesterol doesn't matter. It's not that big a deal, blah, 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 this, and that. It is a big deal. It is a problem. So the range for your lipids is less than 200. So we have your HDL, which is your good cholesterol, and your LDL, which is your bad. You combine them, that number should not exceed 200. Bonus points if your HDL is really high and your LDL is really low. So how does this affect your heart? Well, what happens is you have these cholesterol particles floating through the blood, and what they actually will do is they'll plaque onto the vascular structures. And over time, what this increased plaque buildup will do is will actually start to narrow those vascular walls. So blood actually can't get through. This is extremely dangerous, especially if you get it on a highly valuable vascular structure, such as a coronary artery, which supplies blood directly to the heart. Now, you might get to a point where you have a partial block or a complete block, and this is going to lead to a heart attack, a myocardial infarction. And this is why it's something that you want to take seriously. I don't know if these bodybuilders are doing that. They may or may not, but it's one of those things that it's not going to kill you right away, but it's something that you want to keep an eye on. So if you're a bodybuilder and you are using anabolics, I recommend getting your blood lipids checked every 2 to 3 months. If you're just a regular person trying to be healthy, an annual physical to keep an eye on it is good. If you're somebody who just has chronically high lipid levels, then getting it checked more frequently is obviously going to be very protective, because some people do need medical intervention for their cholesterol. Testosterone and all the anabolics, what people don't realize, it skews your lipids. It increases your bad cholesterol and it lowers your good cholesterol. And this is kind of like a 1-2 punch to really ensure that you are compromising the long-term health of your heart. And that's why these people are saying, oh, it killed them, directly, but it did in a sense because it contributed to factors that really compromise our heart. But then there's also like the effects that, not all these people are going to be subject to that. So what you can do to keep your lipids under control is to obviously, decrease your saturated fat intake. I recommend less than 30 grams a day. If you go less, that's even better. No trans fat whatsoever, and also increase your healthy fats. These are your MUFAs, monounsaturated fatty acids, and PUFAs, polyunsaturated fatty acids, which will actually boost your HDL, which can be quite protective for you. Some people, no matter what they do, it just can't get into range. And this is where, prescription medication can be quite helpful, like a statin to lower your blood, lipids. And a lot of people are like, oh, I don't want to take any medication. Some people have to. If you're a bodybuilder and you're using anabolics and you're just can't get your blood lipids under control, this is something that you have to do. This will kill you in the, and at the, best, just take years off your life, but the worst case scenarios is you're drastically decreasing the time you'll actually spend on this planet. So blood pressure and blood lipids, those are the things I gave you the ranges that you want to monitor closely, bodybuilders and non-bodybuilders. Now, what we're going to talk about is cardiac remodeling, because, it's not just those two things that can affect your heart, it's actually what is happening within the heart itself. Now, most people know this, but if those that do not, the heart is actually a muscle. Just like skeletal muscle, it's striated. It's differentiated by like one thing in particular, and that's its intercalated discs, but we're not going to get into that. The heart is made up of 4 chambers. One that is, obviously, receiving blood and, passing it through another structure, and then the other one is like pumping it through the heart. So, obviously the atrium is receiving blood from the body, and then the right ventricle pumps blood to the lungs. The left atrium receives blood from the lungs, goes into the left ventricle, and the left ventricle will pump it to the rest of the body. That was your quick physiology lesson. When you usually hear of a large person or a bodybuilder passing away, and you happen to hear about, their, autopsy, it's not uncommon for them to experience what's called cardiomegaly, and that's an enlarged heart. Now, when people hear enlarged heart, they think the heart has grown in size as far as diameter, but you only have so much real estate within that, like pocket that your, heart sits in. So what actually happens in the heart grows inwards, and that's what we call hypertrophy. It can be atrial hypertrophy or ventricular hypertrophy. And when this occurs, the reason why this is a problem is because blood has to fill that chamber, and then once the chamber is filled, it pumps. And when it pumps, it should pump a certain amount of blood, and this is what we call stroke volume. Now, your cardiac output, basically how efficient are you at pumping blood to your body, is measured by your heart rate and your stroke volume. The reason why this is a problem, because as your walls start to decrease, there's less blood being filled. And so when you do contract, especially the left ventricle, there's now less blood being pumped to the rest of the body. To counteract this, to ensure that you're getting blood to the rest of the system, your heart rate has to increase. And this is very stressful on the cardiovascular system. And this is almost unavoidable if you're a bodybuilder. So, to tie it all back, for general and for, everyone else, take your health seriously. Keep an eye on your blood pressure. I don't know if these guys were doing that. It's possible they were, but it's also, fair to assume that they did not. Monitor your blood lipids. Those things are important despite what quacks say on the internet. And, understand that if you are going to use any type of drug that has, the potential to grow tissues within the body, the heart will grow too. And these are negative adaptations because it affects how your heart functions, as a, unit with the rest of the body. And this is obviously due to decreased stroke volume. Hopefully this video was helpful for people, a teachable moment on how you can manage your heart health. But if anybody has any questions, feel free to drop a comment below. If you thought this talk was stupid, feel free to comment too. But just, keep in mind that I am not recommending people use steroids. I'm really just talking about what happens when you do use them and their effects on the body, but also how these effects can really, translate to anybody, even general population. So take care and have a great day.